we've experienced an alarming trend in mental health responses, upwards of 300% increase over the same time period last year.
The numbers are increasing. The severity of what we're seeing is more than it had been. Our resources aren't sufficient to really address the problem that we're seeing currently.
People are just despondent. You know, there's a lot of things that have obviously been exacerbated by the COVID situation, you know, whether it be isolation, whether it be financial troubles. Children aren't in school, so they're not getting a lot of exposure to other children. Domestic issues, just a perfect storm, really.
This pandemic feels endless. People's resources and coping skills are waning, I believe, at this point. So people are having difficulty just functioning in so many different levels.
Well, there's two different mental health calls we respond to. One's called a 941, which is the section of law under the mental health law, where a person is a danger to themselves or others. That could either be expressed directly by the individual or a variety of reasons through a law enforcement response call. And once a deputy understands that the person is a threat to themselves or others, they're required under the law to take that person into custody for a mental health evaluation. The second is what's called a 945 custody order, and that is directed by a doctor, by a licensed clinician, who has determined after evaluating this patient that they need further psychiatric care. And they write an order, which we receive, or any police agency could receive, to transport this person to the local psychiatric center.
We have workforce shortages. We have vacancies that we would love to fill. We can't find anybody that's qualified to be hired at this point. So the burden falls upon the staff that we currently have trying to maintain and provide the care that is so necessary for our population at this point.
If someone is indicated to you that they want to harm themselves or have a desire to harm themselves or others, a deputy doesn't have a choice. Under 941 of the mental health law, they have to take them into custody. But when I say arrest, it's just a physical arrest. They're not arrested and placed in jail. They're arrested and transported to a local psychiatric center where they can be evaluated. A lot of times, unfortunately, they're released because here in Delaware County, we don't even have a psychiatric center to evaluate patients. So we're transporting these individuals to either Cooperstown or to Binghamton General Hospital. And a lot of times, because of the lack of beds even in those locations, the person's interviewed and released. And that's unfortunate because we do believe that, you know, a lot of these people that are released are in need of additional services.
These are hospitals that are designated by the Office of Mental Health to provide these evaluations. So if someone is in high need of hospitalization and the police are concerned, those are the only places that they can be taken to be evaluated. I know that Delaware Valley Hospital is working on a collaborative relationship with CPEP in Binghamton where they have some telepractice, but the problem is that they don't have the resources in Binghamton to be able to offer that on a regular basis out of the emergency room at Delaware Valley Hospital. We've had to become very creative. We try to prioritize high-intensity need. We try to refer to other resources if we can. Delaware Valley Hospital has some telepractice that helps with that burden. I know private practitioners are full also. It's tough. It's trying to do the best we can in a very difficult situation.
We talk with our Public Safety Committee over the Board of Supervisors. I've had a lot of communication with Cindy Haney, our mental health director here in Delaware County, and we're actually looking at a couple of different programs we may be able to partner in to make a difference in this area.
We've always had a very strong relationship with the Sheriff's Office, but what we're looking to do is formalize a process where when law enforcement is out in the community encountering someone who has a mental health concern or a substance use concern, that there's a more formalized referral to the community services programs.
These would be programs where deputies could actually make direct mental health referrals. It may not rise to the level of a 941 or a 945. It may be someone that they're just getting a hunch on as far as a person that may be in crisis that doesn't really necessarily vocalize it. We'd create an avenue where we could make a referral for that person, for someone to reach out and maybe engage them. Of course, it'd be voluntary and it'd all be anonymous. It's just one more tool the deputies may have in their toolbox to try to get help to people, especially the ones that aren't asking for help, the ones that may need help that they determine should get some help.
In Essex County, it's called Law Enforcement Mental Health Referral System. Who's going to be part of that referral process? Who's going to go out into the community to follow up? All those pieces really haven't been designed yet. It's very low financial cost, not a lot of training on the law enforcement side, just the ability to identify that there's a need that they can't really address, but want to have some agency that possibly could.
The overdose and the suicide calls have increased significantly, and PTSD is a real issue. Police officers experience PTSD all the time. Matter of fact, this year, 2020, we've seen the most suicides amongst police officers than we've ever seen. So yes, it's a concern for me because they have to respond to these calls, they have to look at these things, they have to investigate these situations. I'm a New York State certified peer counselor, so I myself personally go out and make sure that I touch base with these deputies that are answering these calls, and that if they need referrals, they get referrals.
I am definitely concerned about my staff, just like any other healthcare worker. We're essential. The mental health of my staff is very important to me, and this is tough times for everybody. And I know that my staff have gone into this field because they want to help people, and it's overwhelming, and we want to also make sure that they're okay in this process.
We'll always endeavor to help our communities in Delaware County. That's our first and foremost role, is to respond to calls for service. It's unfortunate that we're experiencing this uptick, but we'll continue to do that and not just maintain status quo, but to work with our community partners and collaborators to make a difference.